for the record. And there we go. All right. It shouldn't exist. Welcome, everybody, to the Career Final Frontier Clinical Tips and Tricks webinar. Tonight's going to be amazing. So, we are going to kick it off with Vidi. I'm going to send it on over to her. She has been a PT since 2018. She's been with Final Frontier since 2019. She's a PT, MS, MBA, OCS, you name it, she has it, and she will be getting it. So, that being said, she is a clinical manager in Boston, and she is also the Associate Director of Career Final Frontier. In the chat room, you're going to be helped by Christina, who is one of the team members of Career Final Frontier as well. But that being said, let the games begin. Vidi, I'm going to send it on over to you.
Thank you, David. I think that's the most hyped introduction ever that I've had. I don't think that I've had a better introduction. We all know where that comes from, right? We all know David, and we all know how he does it. So I think that thank you so much for introducing me. Okay, so first things first, that we're very proud of y'all. Y'all have made it so far. And I think it is amazing how far y'all have come. I know everybody's journeys have been different. Everybody needed different times to get through this milestone, but now we are, and we've gotten through this milestone. So what is Career Final Frontier? I would just like to give a few quick points on what is Career Final Frontier and how we're here to help you. Now, I've put some screenshots up from our website. What we do is we work with the students, we work with y'all into hoping that we can find a great employer for you. Now, how do we do that? We try to match your expectations, and we have partners across the nation, and we try to match our employer's expectation into matching you too. And we're actively involved. The team is actively involved in this process. That way we can help you not only get the right job, but also to know, okay, what to do, where to not be employed, what is the right way of being employed, how to help in the process. So that is one of the things that we do. The other things is that anything that you would need in your clinical journey from now on, in terms of resume writing, how do you negotiate salary, how can you endorse your license from one state to another, and just a bunch of things like that that we help with. That being said, now Final Frontier is not just a one-stop for exam, but it is also a whole, in all one-stop from the exam part to your clinical part. And then you could rely on us and ask us questions. Christina or David will put our email address in the chat every now and then for letting y'all know as to where to reach out to us. Okay. And yet again, huge congratulations, because I don't think that I can say this enough to make y'all feel absolutely amazing of the success that y'all have had so far. And I think that this is a great milestone that y'all have achieved. It is not easy, and we get it because we were there and we did it. So we're aware of how difficult it is and how much y'all have worked hard to get through this. Now I'm going to start with the actual part of what's next. You made it this far. Now, how do we decide and how do we get through that next part? This next slide is very important because I really structured it down to make sure that we can plan and understand better of what our next steps look like. Okay, let's go to that next slide. Now, I like to call it the IDS process. And where did I come across this? I actually use this at work, and I read it in a book called Traction, which is a business side of book of how to manage, how to become a great leader. And what that taught me is that why don't we include this in our setting as well? Not just in the clinical setting, but why don't we use this while we're getting ready and prepped up for our life into the clinical world? Now let's go through one by one, okay? What IDS means: I stands for identify, D stands for discuss, and S stands for solution. Now, if you see that I've tried to font it accordingly, that identify is a little bit smaller, discussion is a little bit bigger, and then solve is your answer right there. Now, what do you want to identify here? You want to identify things like, okay, where am I at in my preparation? What clinical setting do I like to work? Do I live in one state, but I have to work in another state? Okay, then how do I match? How do I bridge the gap? How do I get everything ready to be able to make that move? How do I find good employers in the area? Who do I know is real and offering a good job versus who do I know is just offering good money to start with, and then there is not much to offer after you join that workplace. So all these things, and they may seem like a lot, but these are all good things to consider while you're identifying. Now, on the steps of identifying will be followed up by the steps of discussion. Now, what are you discussing about, and who are you discussing this with? You could literally discuss it with anybody. You could discuss it with yourself, that is expert advice, like I like to say that. You could discuss it with a colleague, a mentor, a friend, anybody from the Final Frontier team. Have someone, I would say, that has experience, that is aware, that has been in the field for a little bit to give you the right advice. A colleague would be able to give you a right advice in your best interest, but they only know as much as you probably know. So someone that does have a little bit more experience than you would be a right person to be guiding you. Make sure you're discussing and analyzing and seeing if you're good at an interview. Have a bunch of mock interviews before you actually go on to your real interview. And make sure that you know how to negotiate salaries. Again, talk about all these points to people that are in the field and that they know better. Try to see what a benefits package is. What is a good benefits package? What is not a good benefits package? What are options for mentorship? Now, there is something that we always say is that when you're a fresh grad or when you are first starting work, it is very, very important to ask for mentorship. It is not letting you down. It does not make you feel small or feel like, okay, you don't know what to do. You do need help. Everybody needs help. And that is okay for us to start and ask for mentorship at this stage. Imagine 2 years down the line when you're now a PT since the past 2 years and you then realize that, oh, well, I do need mentorship. People are going to look at you funny. Then what did you do for 2 years? So it's good, and there is absolutely no problems in asking for mentorship. A lot of companies are actually offering mentorship as a perk to joining their company, and I think that is amazing that they're trying to offer help versus just throw you into a caseload and you're by yourself. So please try to take that very, very seriously. And then after you've had answers to all of these questions or figured out some of this, that's your solution, right? That is when you know what a job looks like for you. What is the best way to get that job? How do you process the hiring process and getting into that line for that job? And how do you actually land your dream job? This, again, may seem like a lot, but this is just a stepwise arrangement of how you could do these things where you can decide what to begin, where do you want to be, and then you actually land up where you want to be. So this is a three-way step. And like I said, it is the IDS process, where the S, solution, is the most important point where you want to reach step by step. Okay, let's go to determining what are your rocks. Now, what do rocks mean? What does it mean that you have a rock? It means that where do you need help? Where do you think that you're going to need guidance? And where do you think that, okay, maybe this is the place where I need guidance. Maybe resume is the place that I need guidance. Maybe I'm not very strong at interviewing and public speaking skills. So maybe I need some help with interviewing or the process of how an interview works, and etc. So that is your rock, that you have to work through that rock to get to that next point. And these rocks could be different from a foreign-based PT versus a resident PT or a citizen, because there could be a lot of paperwork. There could be a lot of things that a foreign-trained PT needs to get through and have in terms of paperwork, in terms of sponsorship, in terms of needing a little more mentorship, maybe because we might not have clinical rotations while we studied our masters or say bachelor's in exercise science or something like that. So we have to determine what our rocks are and then address them accordingly. I'm going to try to see if I can launch a poll here, because I want to see how we're doing and then what is our next step looking like. So I have launched a poll. Take a minute and try to answer this. This poll is anonymous, so I cannot see who answered what. Try to answer to your best of the ability. I'm going to give you all 5 more seconds. I have almost everybody answered up to now. I just need a couple more answers. That's great. So I'm going to share the results, and most of, so about 79% of the audience today has already passed their NPTE, and a little bit is divided into both. They're still trying to take the NPTE and have cleared the NPTE and are looking for guidance for the future, which is amazing. I love all this. And I think that no matter where you're at, you could definitely take help and be prepared before you start into the clinical world. Now, also following up with what we just discussed about rocks and about getting ready, let's see how prepared you are and how prepared you think that you are. I have launched the poll, and let's start to answer that question as well. You give me a few more answers and then I'll end the poll. Okay, that is amazing. A lot of y'all have started the preparation for hiring. A lot of y'all have not started, and a lot of y'all are partially started. So, but I have a huge number that has not yet started. So I feel like this is the right place that you are, understanding and trying to get a hold of what it is like, and then we can go from there. So great. I'm glad that we're doing this, that we can help you in your process. Okay, let's go to the next slide. This slide, I think Christina is going to help us get through this slide. She has experience. She's already been in most of these facilities, and she has a great idea of what each facility is like, and she's going to let us know more about each facility for our knowledge.
Thank you. Hello, everyone, and congratulations on passing the NPTE. What a feat and an accomplishment. And I'm sure everyone is super excited that it's over. So congratulations. That's a major accomplishment, and you all should be very proud of yourself. I totally understand the percentage of you that have not started job searching yet. I'm sure a vacation and a rest break is probably contributing to that. So first, we'll talk about just the different settings that you can choose to work in. So when you think about where you want to work, the setting and the patient demographics is something that should definitely be considered, especially since you want to stay at a job for a few years, get mentorship, get some treatments under your belt, get some experience. So you can work in an outpatient setting. The benefits of an outpatient setting is your patients walk in and walk out. A lot of them are relatively stable. There's a lot of chronic pain issues. There's a lot of orthopedics, a lot of sports injury. You do have to be careful with the access that patients now have, where they don't need a referral all the time from a doctor. So they can walk into an outpatient physical therapy setting, and you still have to know your red flags. You need to know when to refer somebody to the emergency room. You need to know what normal and abnormal presentations are, signs of cancer, et cetera. So you still have to be on your toes and have a little bit of an inpatient brain, but you get to do a little bit more high-level exercises with your patients. You have the inpatient setting. You can work in a hospital, would be considered an inpatient, an LTAC, which is a long-term care facility, a skilled nursing facility we teased out down here. Basically, when you talk about inpatient, you're thinking about where the patients are living there and sleeping overnight for the majority of their stay. So you can see things that range from people that have had strokes, traumatic brain injuries, multi-trauma accidents, spinal cord injuries. You'll likely have an ICU, a step-down unit. You can have transplant recipients or LVAD patients. You have medically complex patients that have multiple different things going on at the same time. When it comes to inpatient and acute care, the populations that you'll see will depend on the size of the facility and where they are in their trauma orientation. Like for a level 1 trauma center versus something that's maybe a local smaller hospital, you'll see different cases, because if the place doesn't have the necessities to keep them alive and functioning properly, they'll airlift them or take them in an ambulance to their local level 1 trauma center so that they can get the care that they need. Which brings us to acute care, which is a hospital-based setting where you have a bunch of different patients with multi-system issues going on at the same time. They do separate the different units. So you'll have a med-surg unit, an ICU, a neuro ICU, you'll have a cardiac floor, a cancer center, pediatrics. Sometimes that's in the same hospital. Sometimes it's very close to the main hospital. It depends on what the orientation and the level of that trauma center is. You'll have an emergency room for people that walk in and have a variety of different things, and a PCU or a step down unit where people go from usually an ICU higher level of intense care down to getting ready to kind of go home. PT will come in and do an evaluation, see if you can go home, if you need to go to a skilled nursing facility, or if you can go to like an inpatient rehabilitation unit. So there's a bunch of different hospital trauma levels, like I was mentioning before. So the population that you see and your caseload and the amount of patients and the volume will vary based on that. I actually work at a level 1 trauma center in an inpatient rehabilitation unit in Hartford, Connecticut. So I am an inpatient physical therapist. I love it. I have worked in other of these settings, and there are pros and cons to everything. So make sure you take a step back and really see, where do you think you'll find your long-term happiness? You also have skilled nursing facilities. These are long-term care facilities. They have holistic care, they have nursing, they have doctors, and people tend to be there as like a subacute type of a rehabilitation. You can do a respite stay at a SNF, or you can actually be a resident of a skilled nursing facility. And then you have home health. Home health is really great in the sense that you get to see people inside their dwelling, so you can help them be more functional and find out ways that work for them with what they have in their house and with their families. You do also have to be careful with home health, especially as a new grad, because you are on your own when you're out in the field. You're likely making your own routes, making your own schedules. You have to bring your own equipment that you would put in your car so that you can do different types of interventions with them at the house. You do need to know when to call 911. You need to know when they're not safe to be at home. You have to know signs of infection for post-op and overall safety, because you will be by yourself. You won't have one person coming in with you necessarily. So just things to consider when you're applying for all the places, because you want to work so badly, because you've worked so hard to get this license. Make sure you're picking a setting that will bring you long-term happiness. So once you decide where you want to work, from the last slide, outpatient, inpatient, acute care, skilled nursing facility, etc., you'll have to look at the organizational structure that you're applying for. You have larger companies and you have small, medium-sized companies. So a large company would be something like in Connecticut, we have Hartford Healthcare, which is a major organization. They have lots of companies. You have Bay State in Massachusetts that has a bunch of different locations. Those are like large organizational structures that have a bunch of different locations. Then you have smaller, medium-sized companies that are not as big. They don't have as much of an imprint in the community, but they still can have multiple locations, or you can be just going to interview for a mom and pop cash-based outpatient clinic. So when you're going through this process of figuring out, make sure you know the organizational structure, because the way that you interview and the process for you to get hired will vary depending on the organizational structure. So for a large company, for example, a lot of things are online right now. You'll submit your resume online. They'll ask you to upload a document, give me a link to your LinkedIn account. They'll pre-vet you. They're looking for keywords to kind of isolate people that are most likely to be appropriate for whatever position is open. An HR representative will usually call you and say, hey, we saw that you've submitted your application. We would love to set up an interview or a phone call. So you go through an HR round where you talk to human resources. They'll tell you kind of what to expect for the job, their process of hiring people. You'll get asked to go to the next phase. After you do that, usually the clinical director or the manager for your rehab department will do maybe a pre-interview phone call. They'll kind of say, this is what we usually do. We have people come in and shadow sometimes. Sometimes we have a peer panel where you can stay for maybe 5 hours of the day. You'll shadow for a little bit, have lunch with us, sit on a peer panel where your peers are also interviewing you, and you can get the vibe of the situation in the setting, and they can get the feelings from you to see if you guys will be a good mix with each other. After that is all over and the interview is done, your peer panel is done, your shadowing, if that's an option, is done, human resources will be who calls you back and says, you've gotten the job, congratulations. So there's a lot of different people in a larger company that all have different jobs that are a part of the process. When you go to a smaller, medium-sized company, it might be different. You could submit your resume online. You could get hired by word of mouth because you know people in the physical therapy community. You can see that they're posting a job opening on LinkedIn and you want to reach out. And the director or the founder might be the person that you're speaking to, especially if it's a small company that's like a mom and pop kind of personally run business. So they'll call you in, say, hey, I really liked your resume. Can you expand a little bit? Maybe I would love to schedule a date and time for you to come in. You'll go in, you'll interview with them. They might also ask you to shadow so that you can see the population, see how the clinic runs, make sure that you're going to jive well with the people that are already working there. And then they will call you back and say what their determination was. Congratulations, you've gotten the job, or we've actually hired somebody else. Thank you very much for applying.
Thank you, Christina. We'll try to now talk about how do you prepare for an interview, and then we'll go through some common questions and how what are the interview questions that you could be ready for. So this slide could seem like a lot, but what we've tried to do is we've tried to give you everything that we do think that you could see or you could start to prepare for. Now, main things to consider while preparation: what do you really want to know, and where do you want to really prepare as to be able to throw in any questions? My biggest thing is that you should be prepared for both your personality related questions, character based questions, clinical and non-clinical questions. And what do I mean about those? That they could just ask you a very simple question of a daily living. It could have nothing to do with physical therapy, but they're trying to see how you are as a person, to see if your personality in general matches with the personality of the clinic or the people working in that clinic or the core values of the company, right? So you are supposed to review. It could be a small company, it could be a larger company. Everybody nowadays are very true to their core values and do have them that they follow. They do follow something that makes their organization different from another organization. So I would do a good homework on what their core values are and try to give some examples of the qualities that you might have that match to their core value. And that would really set you up on the top of them considering you for that position. How would you keep it real is by having a patient scenario or an experience that was difficult for you and how you got through that difficult experience with a patient, with a family member, with a friend, anything. Because what they want to see is, are you able to negotiate, educate, try to pace a patient or try to get through a difficult situation, a difficult case. So it'd be while you're working, and the only thing that they can do that is with trying to see if you've had a difficult patient experience, try to see if you've had a difficult experience in general in your life that you got out of and how you got out of that. So it's very important to have that. Another thing that I haven't included on the slide here is if they do ask you your strengths and weaknesses, I would very, very, very honestly name your weakness. And it is okay to say, yes, that you have a weakness and then this is your weakness. Not determining your weakness, not having self-awareness about your weakness is actually could run negative towards you, because we all do have weaknesses, right? So do have that response of that if you were to name a few strengths and a weakness, is that you know those both the ends of those. And then you could also answer them as to how you are working towards achieving or making your weakness better. And that is totally okay. It's good to also have a plan in mind, both personal and professional. And that really gives the employer the confidence that, yes, you are someone that has a growth mindset, that is thinking about a couple of years from now and has laid a path of how they want to go forward. Another thing to keep in mind, especially, is that we have a lot of evidence that keeps changing every so often. That being said, what we might have learned in school a couple of years ago might not be the same. And when we're treating all these patients, we want to make sure that we want to be very, very, very ahead of the evidence. We want to be current, and we want to treat all the current strategies that are being told that are most useful for our patients. So make sure that you always have that in mind, that you're going to always have to dig into these new evidences and treat your patients according to that. That shows that you have empathy, you have you have excellence towards the service that you're trying to provide for your patients, and that just gives you a little bit edge up. Christina's going to let us know of what the common questions are and how do we answer them and how do we get prepared for them.
Yes. So during your interview, there's usually, like we had said in the previous slide, there's going to be some questions that are more personal and personality based, situation based, and there are going to be some clinical based questions. There was one job actually, as a side note, that I interviewed for where they actually emailed me a case study. And that was a part of my pre-interview, was they gave me a case study and I was to respond how I would treat them, what things I would pay attention to, what outcome measures. That only happened in one situation. It was a larger home care company. However, that's another way that they can try to separate clinical from personal if they want to get to know you more so in the interview and the clinical side of you when they can read it kind of at their convenience. But some of the things that they can ask is for you to describe your experience. You can always practice putting together a 30-second elevator pitch where you talk about yourself consistently going up and the things that you have to offer the company. It's short, it's concise, it's to the point, and has all of the important things that you want a company to know that you can offer them and to the patients. They could ask you what some of your personal goals are, you as a person, you as a clinician. Those can be two separate questions. Why did you decide to become a physical therapist? Why did you specifically choose this setting? How would you handle a patient that was upset? How have you handled it in the past? How would you handle it in the future? Where do you see yourself in 5 or 10 years? Give me an example of how you handle any kind of conflict at work. This question is actually becoming extremely popular over the last few years because they want people to have safety in the workplace, which previously over the last 10 years or so, people did not care as much about mental health and making sure that there's emotional, physical safety in a job place. You were expected to go to work and do a job and not complain and go home. With healthcare and COVID and everything that has happened in the last few years, there's been a real push for mental health. And they want to make sure that everyone gets along well and handles conflict appropriately, has healthy communication styles, and knows how to get the help that they need so that they can retain their people and people don't get burnt out and resentful and end up leaving anyway. So one of the good things that came from everything that's happened in the last bunch of years is this push for mental health. And that allows you to answer a question like this. How do you handle conflict with your peer, with a boss, with a rehab aide, with a family member during family training, with a patient, etc.? They ask very often, what is a positive story that you've had or an experience with the patient in the past? So think really hard about someone that really resonated with you. Maybe someone had come a long way in their therapy and it was really inspiring, and share that story as well. Sometimes they do ask, depending on the setting, what your most upsetting story was too, because unfortunately in some settings, the patients do pass away or something doesn't go right. So they also want to know how you handle things that don't always go well, because in life, things don't just go well. Things go up and down and all around. So they want to see how you handle stress, how you handle positive moments, how you handle sad moments, how would you do in a stressful situation. So it's nice to just have a few stories or experiences in your interview day to elaborate a little bit more on that. Sometimes they ask, what would you consider to be some of your strengths and weaknesses? I wouldn't list a ton of strengths and a ton of weaknesses. I would pick a few of each and frame your weaknesses to be a strength. And that's something that we can also help you with too. So that even though you're pointing out that you have a weakness, make it seem as if it's something that benefits the patients in the company and you want to continue to have a growth mindset and work on those things. And your weakness just so happens to also benefit the people around you. How would you handle a patient who struggles with following directions, or someone who can be a little bit home exercise program non-compliant? What skills do you bring to the program and to the facility? So those are just some of the more common things that you can start rehearsing with a mentor, with a coworker, with a friend, with a family member, so that on interview day, you don't have that answer paralysis where we're just like, there's so many things going on in our brain, or we have a bunch of answers, or total blankness. You've at least rehearsed the situation and you're not as anxious in the moment. So interview day. So interview day for me actually starts a day or so before the interview day, because you're already working on your resume. You're making sure that you have copies printed. You're making sure your reference phone numbers and email addresses are correct. You have everything in a nice, pretty little compact folder that you bring with you. You have a pen that writes. You have your license printed out, or any special certifications that you would want to have on interview day to present to the person that is interviewing you. You've already looked up the address and know how long it takes to get to the place. You've picked out your outfit. So for me, interview day starts a little bit before the actual day. However, some of the tips for interview day: make sure you have everything you need before you leave the house: keys, wallet, license, resume holder, etc. Make sure that you take a few minutes before you walk into the building. Take some deep breaths, say affirmations, find your center, find peace before you go into the building, because anxiety and fear, although it's normal, is an energy that can be felt by people around you. So if you take the extra time to kind of calm yourself down, empower yourself, find your confidence, fake it till you make it if you have to, and then go into your interview, it will go a lot better for you. Make sure you're in the right clothing, formal if you're going to be going in a dress or a tuxedo or a business suit or something like that. If you're shadowing or going to an inpatient setting, they might ask you to wear scrubs. They might ask you to wear a specific type of scrub or color so that you don't accidentally get mistaken for someone that's on the full-time staff. Make sure you arrive before your interview time, not on time. So on time is late. You want to make a good first impression. And one of the ways that you do that is you show up ready to go with all of the things that you need for that interview, and you're there early. That way you are ready to go and in place for the right time. It shows that you're serious and you're taking the situation serious, and that you can be trusted and that you're responsible. Look and talk with confidence. Take minimal notes. A lot of people sometimes worry that they're going to forget all of the things that are being said to them in the interview, because they will tend to give you a bunch of information up front, especially if you ask the right questions. Don't worry about taking so many notes, because when you get hired, they're going to go over all the stuff again in your orientation, or you're going to have a preceptor, or someone's going to come and go over all of the things again with you. So remember the things that are most important to you and the things that stick out the most. You can feel free to jot those down a little bit, especially if you have a resume holder that opens up and has a notepad on one side. So you can have all of your things in one sleeve: your resume, your license, your reference list. And on the other side, you have your pen and a notepad so that you can write stuff down. Be prepared to describe yourself in your elevator pitch, 30 seconds or less. Bring your resume and reference list. Be aware of your tone and your body language. Don't close yourself off. Don't cross your arms. Don't jitter or shake your leg a whole bunch. Biting fingernails, fidgeting, shaking your legs, etc. These are all signs of anxiousness and fear, and that can be off-putting to people. You want to be calm and cool and confident as much as possible given the circumstances. Always come with questions, which is why it's good to review the company website beforehand, because if you want to ask expansive questions on things that you read in the About Them section, or in some of their patient stories, or some companies post videos of some of the things that they have at their facility, like aquatics, a pool, any kind of special population or special fundraisers or walks or things that they do. So you can come ready to ask some of the questions about the company, but also questions that are going to be meaningful for you, right? How do you quantify your productivity? How do you track productivity? What is my caseload? How many hours am I expected to work per week? Do you feel like your staff has good work-life balance? Is there mentorship available for me? Will there be a preceptor? Are there program managers, treating managers, etc.? All of these things that are not related to salary and benefits, because that's usually the HR. You wouldn't bring that into an interview. That's not really appropriate to ask at that time. But anything that would benefit you as a person, as a clinician, and things to elaborate on the expectations of the company would be the things that you can pre-write down on your notepad and ask at the end when they say, do you have any questions? Because it always looks better to have questions than for them to say, do you have any questions, Christina? And you just sit there and say, no, because we are not needless people. We do have questions and we have needs. And it's good that we ask those things up front so that we show them who our true authentic selves are. And that was just an example of some of the questions in the bottom there that I kind of already elaborated on.
Thank you, Christina. That was great. Now we're going to go through some of the things that we actually do in the clinical practice, right? We all deal with insurances. We all deal with a number of different kinds of softwares, some CPT codes, ICD-10 codes. Now, what are all of this? And do you know Do you have to know each one of these before you go for an interview or at your first day of work? My answer would be no, because you don't have to know everything. You have to go this step by step, right? You could know a few insurances by name. You would have an insurance, so you would know some of the insurances and how they work, but you don't have to know them to the T. That is up to learning, and you will learn as you become a part of the facility, as you become a part of the profession. Just having an idea of how to document, or just having the basics to see, okay, what do we do in terms of documentation? How do we try to make sure that we're writing something correct? Have you heard of SOAP note? And that's probably it. It just could be different from software to software, but the data that you're going to put in doesn't really change it. The where you're going to put in this data might change, but not how you're going to put it or what you're going to put it. So don't be afraid, or don't be very overwhelmed with something that they mentioned that you might not know about, or you might need some help and guidance about. It is totally fine to not know all of this at once. We do list down some of the common ones, some of the common insurances, some of the common documentation softwares that we've heard that most of the companies use. These are some of the common CPT codes that are used for billing. Does anybody know any of the CPT codes? And just to play a fun game to know, okay, what is 97112? What does it stand for? Anybody in the chat? What does that CPT code stand for? Yeah. David over there is trying to show off. Yes, it does stand for neuromuscular re-education. Yeah, too many notes. It's our life now. So it's good to know some of these CPT codes that will give you an edge when you're going for an interview. Of course, you don't have to know all of them, but find out what they are, find out why to use a certain CPT code at a certain time versus which one's better versus the other for a particular exercise, right? And ICD-10 codes, again, we do not expect you to remember these, but these are very easily available online. So say if you're looking for an ICD-10 code for lower back pain, and if you just write that ICD-10 for lower back pain, you're going to get something. You're going to get M5 4.5. So you can just find out that online. So you don't have to mug it up. The more you do this in your practice, the more you will start remembering them. I probably now, Christina, David, we all probably remember some of them by heart now because we've used it a million times. If you ask me if I remembered that on the first day of work, I did not. I did not know any of this. None of the information on this slide is what I knew when I first started work. So it is okay to not know, but it gives you an edge now that you have the ability to know some of this. It just gives you a little more confidence going in that, yes, I am aware of a little bit and I could catch up and take some help on the little bit, which is absolutely, again, fine. Being confident is good, but being honest is great. Letting them know where you stand and what you need help with and where you can start with, just giving them the confidence that, yes, this is what I know, this is what I need help with, and here's how I'm ready to dive into this and make sure that I give my 100% towards it. And that is literally the best way to go about this. Some things to consider on your first day of work. Like you went for an interview, you want to make sure that you're on time. Not just the first day, to be honest with you, every day at work, you want to be on time, before time, just to make sure that now you are accountable for someone. You are accountable for your patients. You are accountable for the clinic, for the company. So you want to make sure that you have those practices, not just during an interview, but during your day-to-day practice as well. You could have some cheat sheets about a SOAP note. Okay, what would you need on a subjective section? What are the common questions would you ask your patient? What are the common tests that you will do, or common objective findings that you will do for your patient? Now, this will matter and change a little bit from facility to facility. That's why you want to make your own cheat sheet depending upon which facility or work that you're trying to choose and you are going to start working. So make sure that you determine that, you see what's important in that particular field of facility. Say inpatient might have a little bit different than outpatient. Skilled nursing facility, you might do a little bit different. So you want to make sure you have these cheat sheets ready for you so that you don't feel overburdened or you don't feel scattered on your first day of work. That first patient is very, very special. I still remember my first patient, and I don't think that I will ever forget that. That being said, if you are nervous, your patient knows. It is okay, again, to go slow, to do as much as you know, refer back, study, and go in next day and help them better. But try to be confident in what you know. You already know what you're doing. Not being confident with them, around them, is not going to help them gain confidence in you, right? We all have our first. No doctor, no engineer, no lawyer did not have a first day of work. So that's okay to be at the job on the first day and just do as much as you can without being overwhelmed, without being nervous, so to speak, so that the patient that is getting treated by you catches off your anxiety and doesn't feel confident in you. That will only affect you more, make you more nervous than feel better. Do not hesitate to ask for help. Please always ask for help. The good side to this is that you work with a bunch of other clinicians, and that is a safe space. That's a great place to ask for help and try to get that help as you need, to try to help you in becoming a better clinician every day. About documentation. Now, I've heard a huge discussion, different places, different forums, that, okay, what is the whole fuss about documentation? Do the companies give you some paid time for documentation? How do you manage documentation? Now, hopefully when you're first starting out, you might not have to have too much caseload all at once so that your documentation doesn't become an issue. But try to see if your company, if your work organization is allowing you that rest, that decompressed time to be able to document. Because go is not the way that you're going to be successful, because there's a lot that you have to do this probably for the rest of your life. So if you want to be clinicians, and you want to make sure that you have appropriate work-life balance, so know what to document, know how much to document, and then make sure you know that there is time that you decompress between seeing patients and documenting, to make your work-life balance really, really meaningful. Quick question. Do you think that the patient and the real case scenarios are equivalent to the NPTE that you just gave? Tell me in the chat. A big no. Everybody's saying no in full speed. So that's great, because yes, not necessarily in most of the cases. Yes, you pick off of what you have learned and apply, but scenarios do not remain the same. 2 low back pains, 2 neurological conditions, 2 spinal cord injuries are not the same. And that is why you do not just treat off of what you studied, but you treat off of what you see, what the symptoms are, what do they need. So every patient will have their own curated, structured care into how do you make them better, right? If you just try to take from the theory and paste it to the patient, you're not probably doing it in the right way. You're probably not going to see success, which will, again, make you more nervous. So try to keep that in mind, to see that symptom, to see what your patient needs, and then driving your care out of that. Okay, how do we do the process through Career Final Frontier? Now, before we head to this slide, I have one more poll, because I think I've talked a lot, and I think we can go on and try to answer this poll. Okay, do you guys see the poll? We do not see the poll. Okay, 1 second. Sorry, let me just try to launch it again. Okay, I think now you all can see that, right? Okay. Perfect. Okay, a couple more seconds. Guys, we're getting towards the end of this. I know it's a Monday evening and you probably want to enjoy with your family the new success that you've just had, but just hang on to me just a couple more minutes. I'm going to share the results. Okay, good. 60% of y'all are confident and know about the electronic medical records, which is good. And that's a good thing to know. A lot of y'all know about the ICD-10 codes and where to find them and how to apply them. That's great. And the things that we need help with the CPT codes. And again, it's okay. You will still be able to go through that. Someone will train you. There will be mentorship and you will be able to find out. If you need more help, you are always welcome to sign up with us for any help that you need. But again, this is just to let you know that these are the things that you may or may not see in your interview. I have one more poll, but then I'm gonna leave it for the end. How do you go about with the process with Career Final Frontier if you'd like to become a part of Career Final Frontier and make us help you find your job? You have to find out where do you need help, right? See from this webinar, try to take some points and see where you need help. Where can we help you? Where is your weakness? Where is your strength? Try to put those things together and reach out to us. You can reach out to us on our email, that is support@careerfinalff.com. So I'm going to put that down in here in the chat. That's where you can reach out to us and the Career Final Frontier team. You can join our Instagram page to know more about any of the tips that we share, to get in touch with the community of clinicians and interact with us there. And then you can anytime get in touch with us for any questions, concerns. If you want to sign up for any of the services that you could take some help for. And now is the last poll. I want to see how y'all feel about this question. Okay. Like, I'm really interested to know what your thought process is, and then what would you like? Look at that. You guys are answering so fast. Lovely. Okay, looks like I'm going to end the poll in 10 seconds. So try and go ahead and answer what you think that you would choose if you were to put in this scenario. Okay, I'm going to end the poll and share the results. Okay, so 70% of y'all chose an average base salary with good benefits and CEU benefits. So the company is paying for your continuing education. But 30% of y'all chose higher base salary, fair benefits, and out of your own pocket for continuing education benefit. Now, if I were you, I would choose an average base with good benefits and CEU benefits. Because it's not about an average pay, so to speak, that there is low pay. What I tried to make these two things, I tried to make sure that I'm giving you a little bit of feedback into understanding that you want to make sure that you have good benefits. You want to make sure that the company is involved in not just their growth, that okay, they hired a PT, now they're going to make a lot of money. No, but they're equally interested in your growth. They are interested in you learning ahead, getting into that new evidence, doing continuing education, learning new treatment patterns and procedures, and that they feel responsible to give you that hand-holding and to give you those benefits to be able to learn those. You shouldn't have to pay all of it by your pocket. That being said, good benefits in terms of having a good medical insurance. They can include a bunch of things while they're negotiating salary to make sure that they make a great overall package, but that necessarily doesn't have to have a very high base salary. So make sure when there is an organization trying to make a full package out of a salary, that you consider not just the average or the base pay, but also what are the benefits, how good or bad are those, or how good or average are those, and are they chiming in, or are they making sure that you are growing as well as a clinician and not just them having growth because now you joined their team. So I will stop sharing these. I'm gonna close down our poll and we will hang on here for questions, for any concerns that y'all have. Again, I want to say how important it is to keep all these points in mind. It might seem like a lot, but it's really the process that we were trying to get you through today so that you are well prepared and more prepared from what you were before you joined this webinar. Thank you. You all have been great. And I think that you're going to be great clinicians. I am going to stay here. I and Christina and David are going to stay here for a little bit more. If y'all have questions, go ahead, type them in the chat, ask the questions that y'all have.